Welcome to the second hour of the Elias Macko Show. Let's talk about the flu vaccine. Here's a question I've gotten on the text line, our 514-800 text line. I've seen this question sent to me so many times over the last little while. Elias, we give the COVID vaccine for free. Why aren't we giving the flu vaccine for free? It's a very good question, and it's a question that André Fortin from the Quebec Liberal Party, he's also been posing this question. He's the party's official opposition critic on matters of health, and he joins us on the line this morning. Monsieur Fortin, bienvenue.
Good morning.
It's great to talk to you on the show, Monsieur Fortin. Can I call you André? Are we okay with that? André? Okay, fantastic. So let's talk about this question, the flu vaccine. Like I said off the top, I have listeners saying, Elias, I don't understand why I have to pay for this vaccine. If it would help our healthcare system and avoid me going into the hospital, why do I have to pay for my shot? What's the answer there? Why do Quebecers have to pay for that?
That's a very good question, and it's a question that we've put to the health minister this week, because in his own press conference, he made a point of saying there are three things that are really really pushing occupation of our hospitals, our emergency rooms. Obviously, the children's respiratory virus that's going around these days, the COVID-19, which is still sending a lot of people to our hospitals, and the start of the flu season. And he made a point of saying, well, it's just now starting. There will be more and more people hospitalized because of the flu. And he encouraged people to go get the vaccine. So at that point, if we're encouraging people to get the vaccine because we think it's going to have an impact on our hospitals, why not make it free? For a family of 4 or 5 people in Quebec right now, you can pay about $150, $200 for the flu vaccine. And that does make it cost prohibitive for some people. And unfortunately, will have an impact on our healthcare system. So that's why we asked the health minister this week to do what every other province in Canada is doing and make that vaccine free for everybody. Okay, so now that's where it gets interesting, right? So other provinces are doing just that. They are giving the vaccine for free. We know the government seems to be flush with money, right? They're sending out checks over the next month to Quebecers, $400 to $600. They're promising a freeze on certain rates. So is the money there? Is this an issue of money? I certainly hope it's not. If it's an issue of money, quite frankly, our hospitals and our hospital workers deserve better than that. We're not saying every year that it needs to happen. Maybe it does. Maybe there needs to be a fulsome study on this. But this year, given the very real situation in our hospitals, given the prevalence of other viruses that are going around, which is putting an extra strain on our hospitals, why not make that expense, which in turn may actually save our hospital system some money? So if 9 provinces out of 10 make the bet that this is a worthwhile expense for the health of its citizens, for the safety and availability of care at our hospitals, why wouldn't Quebec follow along in the same track? And just so we're clear for our listeners, so certain people do get it for free, right? Depending on your age. What ages do you get the flu shot for free? You do get the flu shot for free if you're 60 and over. If you have some chronic diseases, if you are pregnant, you do get the flu shot for free. But as I said, in every other province, in Ontario, for example, if you are 6 months and older, you can walk in, get the flu shot, walk into any drugstore, get the flu shot, and it's absolutely free. A lot of employers offer that possibility to get the flu shot on site for free. In Quebec, it's just not the case. You walk into a pharmacy and it will cost you roughly $25. Now, the government does see some benefit in it, because when you register to get your latest COVID vaccine, they are actually asking you on the platform now, do you also want the flu shot? But you're going to end up paying for it. So it does make it somewhat prohibitive to people, and there really is no reason to do that. No doubt. Charging someone $30 or $40, a lot of people will say, nope, sorry, not worth it. Even if it is worth it, it's just hard to pay that money. Now, let's move this on here. I want to talk about healthcare a little bit more broadly here. I guess I have to ask you, for the Liberal Party of Quebec, how do you rebuild confidence for the Liberal Party of Quebec
on healthcare, right? I mean, you guys were the party, right? For like 15 years in a row, with a little brief hiccup there of 18 months when the PQ was in power. You guys were responsible for healthcare for so long. So how do you get Quebecers to say the Liberal Party Quebec is the party that is the one to pick on matters of healthcare?
I think you come out with very tangible, very concrete propositions like the one we made this week. If you try to take on the healthcare system and healthcare issues as a whole, it does seem like a big, huge file that most Quebecers probably think will not necessarily get better, or it's made of empty promises. But if you take it issue by issue, like this one, which is a very tangible measure to reduce the strain on our emergency rooms and hospitals, I think you can make a difference, and you can. And if you make propositions like that, like propositions on pre-hospital care, ambulance workers, and what they can do. If you look at the issue this week of nurses, which are at the core of our healthcare system, not being able to pass the exam and to keep practicing their profession, you can make somewhat, maybe there are small steps, but you can make some steps into improving the situation. And I think that's how you do build a reputation, and you do tell people that, yeah, they are proposing measures at the Liberal Party that may make a difference in our healthcare system.
With André Fortin from the Quebec Liberal Party, he's the party's official critic on matters of health. What do you think about Christian Dubé and the job he is doing as health minister?
I want to see him succeed. To be quite honest, we need a healthcare minister that will do well. One of the things that he has done well is being transparent. He's available. You see him a lot explaining the measures that they are trying to do. So I will give him points for that. But at the same time, there seems to be a lot of things that are put forward which are very administrative in nature. Right? There was a wait list for family doctors. We transformed that into a wait list for access to a family doctor. There was an 811 line. Now they created an 811 line for children, for pediatric care. So it seems very. He gives the impression that he is trying to improve the system, but it comes very much in the form of administrative measures which haven't yet been proven to have a real impact. So if he is willing to listen to good ideas, to ideas that are being put out there, to questions that Quebecers are asking, and making common sense decisions, like if he were to accept to make the vaccine, the flu shot, free to everybody, then I'll give him extra points. But at this point, we're still I'm giving him a chance, but improvements do have to happen in the short term.
While I have you on, I need to talk to you about your party in general. And I don't want to ask you to air your party's dirty laundry. It just seems like you guys are doing it voluntarily a lot over the last little while. We don't even have to ask. You're just handing it out here. So let's talk about the Quebec Liberal Party and what you think needs to happen short term to right the ship.
Well, we need to make some very tangible propositions that reach Quebecers, and we need to talk about why we got elected, why each and every one of our members decided to run for public office, and the issues that they want to change in the Quebec government. And one of the reasons that we are in this situation that you've just described is because we haven't been talking about all those issues. We've been dealing with internal matters, and obviously it has partly cost our former leader her job as well. So once we get to make propositions, to talk about issues, to talk about what Quebecers asked us to fight for, then I think we'll find our footing, and we'll be on the right track. And hopefully the assembly resuming, and the opportunity to ask questions and to ask and to make sure the government is held to account in the coming weeks will be the opportunity to do just that.
Are there two types of liberals inside the Liberal Party of Quebec right now? Are there like Couillard or Charest liberals and Anglade liberals, and are they having trouble getting along?
I wouldn't even say that anymore. If you look at the makeup of our MNAs who were just recently elected, most of them are brand new. Most of them just got elected for the first time. They come with impressive backgrounds, and they make up the majority of our our caucus right now. And I think I was elected in 2014 for the first time, so 8 years ago. And I'm now the member who has the third most seniority. So you've seen a lot of turnover.
Yeah.
And I would say most people at this point are just eager to get working on their files and to improve the services that Quebecers get.
Last question for you, and that is, are the wheels in motion for you to start a bid to lead the Liberal Party of Quebec long-term as the full-time leader?
The wheels are in motion for me to have a true reflection on whether this is something that I can do, that is the best way for me to help my party. I'm going to take the proper time. Dominique Anglade resigned from her post about 10 days ago now, so I do want to give myself the opportunity to have a real think through about this, to measure the implications, to measure whether this is the best thing for my family, but also for my party. The one thing I am focused on, though, is making sure that we do offer new ideas, that we do offer a more concrete definition and vision of what the party is, and that Quebecers can see themselves in us. So before a debate on personality, I think we do have to have a debate on ideas. And so that's why I've started to talk to party members across the province to see what they have in mind and what they want to hear from us these days. All
right, I'll let you go with that. I know you're going to be busy trying to find a candidate for St. Henry St. Anne in the by-election that comes in the next little while. Monsieur Fortin, André, thanks so much.
Have a great day.
That's André Fortin, Quebec Liberal Party, official opposition critic on matters of health care, the MNA for Pontiac.